And that conversation segues nicely with this week's in-depth discussion. ACEs stands for Adverse Childhood Experiences. There are 10 of them, and the more of them a child encounters, the harder it is to navigate toward adulthood. Moderator Susan Cadot and her guests discuss what's being done to help.
I am joined today by Joe Dorman, who is the CEO of the Oklahoma Institute for Child Advocacy, and by Annette Jacoby, who is the director of the Oklahoma Commission on Children and Youth. Thank you both for being with us.
You bet.
You're welcome.
Annette, I'd like to start with you. We're going to talk about ACEs. What is ACEs and what are some of the markers for that?
ACEs stands for the Adverse Childhood Experiences. And it's a term coined for basically a research project that started in the 80s. We had two gentlemen on both sides of the coast noticing that they had adults with health problems that they were beginning to believe were connected to experiences they had as children. And so what we know is that when children experience physical, sexual, emotional abuse or neglect, or they have disruptions in their lives, being separated from a parent, either through death, divorce, or incarceration. If they have a family member with active mental health or addiction issues, or if there's violence in the home, we know that these things have lasting impacts often on adults, and that these correlate highly with heart disease, with all kinds of issues later on in life. So while we often want to think that if we remove a child from a bad situation, that all will be well, that's not that simple. So what we want to do is we really want to talk about preventing ACEs and how can we support families so they don't encounter these challenges and therefore their children won't be as likely to grow up with these kinds of health struggles, addiction or mental health struggles as well in adult life.
Joe, I want to come to you now, and I've got to put my glasses on for this one. The legislative session is over. How did Oklahoma children fare this year when it comes to bills?
ICA does an annual scorecard on the lawmakers and how they treat children's issues. And we're compiling those numbers right now. I will say there were some tremendous bills that were passed in the legislature this year. Unfortunately, some of the bills dealing with children's mental health and specifically with child trauma that would relate to how we handle those issues in schools were left on the table. So we're going to be aggressive about trying to get those heard last year. And that was a bipartisan effort. Both Democrats and Republicans worked hard on these issues. Overall, the session did consider quite a few ideas. We had bills that dealt with different types of training for teachers to recognize ACEs. One of the significant issues was in the appropriations bill where $10 million was given to OU Medical to work on children's mental health issues. So I'm optimistic and feel positive about a lot of the work that did happen this year.
Can you talk about a little bit about Senate Bill 140 that gives a second chance to young offenders who don't qualify as juvenile offenders?
Yes, that is the regimented inmate discipline bill, expanding that from age 21 to age 25. This will look at youthful offenders who have been incarcerated for a nonviolent offense, something that there's a list of about 40 laws that they cannot have committed a crime and been convicted of that, where that would just exclude them. But this is raising the age from 21 to 25. It's almost like a paramilitary program where it teaches them not only life skills, but also to build their self-esteem and the respect. And it actually had decreased in use because of the passage of State Question 780 that lowered the offenses from felonies to misdemeanors. And so Senator Brooks and Representative Newton filed this bill to increase the age to try and get more inmates into this program, to try and curb some of those issues that they face and give these young people a second chance by learning the life skills that they needed to learn as children and hopefully give them that second chance.
Last time we spoke, Joe, there was one measure we spoke about, I believe it was last January, about preschoolers being suspended. Can you talk about that? That really surprised me back then. What's the latest on that now?
It's amazing for all the work that Oklahoma has done for second chances, for working on incarceration to give people a second chance. We've looked at the adults, but in contrast, we've had bills filed at the Capitol that would lower the age from sixth grade down to preschool for suspending a child. On the books right now, it would take something significant to suspend a child of a younger age in grade school or preschool. We've had some lawmakers be expanded or decreased in age down to grade school. We did not see anything come about from that this year. We have worked on that issue for 3 years, trying to raise awareness with lawmakers. This is the true school to prison pipeline. When we suspend these kids at a young age, that's teaching them that they're bad kids. And you're sending them oftentimes back into the situation that causes them to lash out. And so we actually saw a bill filed this year that would help address that concern. House Bill 1773, filed by Representative Sherry Conley, deals with multi-tiered systems of support that will teach these educators in continuing education classes about ACEs, about recognizing signs of trauma. And the tagline we often use, we don't need to ask what's wrong with the child, we need to ask what happened to that child, what has caused them to lash out.
And I just want to make another point. I think that as we have grown and learned about the importance of early childhood, we know that probably the most significant things that 3 and 4-year-olds learn is their social, emotional aspects of being in a classroom. Mm-hmm. It's important to learn colors and ABCs and numbers, don't get me wrong. But the most important things that these little people learn is how to sit in your space without touching other people, how to be quiet when the teacher is talking, and how to be in line. It's just how to be in community. And there are kids who do better in those settings and kids that don't. Some of those kids that don't may have a learning disability that can be remediated with help. Some of them may have issues at home that are causing them to act out. But truly, I think what is so sad is if you expel a 3 or 4-year-old, you're taking them out of the opportunity to do just what we wanted, and that's to learn how to behave in a classroom. So we should anticipate that 3 and 4-year-olds have a difficult time in doing that. That is absolutely understood.
There was another bill that ties right into that. I want to give that due credit. A play-based learning was authored by Jake Rosekrantz. That idea of basically teaching these kids through a play-based system where they're active and learning how to interact with others, that's going to be vital for building, especially coming out of this pandemic.
There's going to be, that's something to talk about again, what happens coming out of the pandemic. And you were mentioning earlier, Joe, about the numbers. Annette, I do want to stay with you for a minute. Last year, the Oklahoma legislature passed House Bill 1282, restricting youth detention for young people. I want to get this right, under the age of 15, and prohibits young people 12 years old and under from being placed in state juvenile detention facilities unless all alternatives have been exhausted. Why is this important? Some 12-year-olds can get up to Dickens, especially it seems lately. I don't know if it's that I'm getting older and kids are just more, they seem to be like, oh, those kids are up to no good. Or if it's really a fact that kids are more, I don't know, they seem to be more grown up in how they behave and what they do socially. So I wanted to find out that and what are those alternatives?
So, great question. First, let's recognize that the detaining of youth in Oklahoma as well as across the country has dramatically been reduced. Dramatically. We're seeing less and less kids in our systems, and when they are, it's usually for more serious offenses. So I think that there are a lot of reasons for that. There's a lot of thought that cell phones have contributed to the reduction of kids in our juvenile system, because a lot of times, a lot of the issues that we're bringing them were property crimes. It was joyriding. It was doing these things. Well, if a way to connect with your friends used to be in person and causing trouble, now you can connect with your friends through cell phones while you're in your bedroom, and you may or may not get in trouble. So you may get in trouble in other ways, but you're not getting in trouble for property crimes and some of these minor offenses. So let's recognize that. Our goal is to really keep kids out of county jails. And you may say, I didn't even know there were kids in county jails. And from time to time, there are, and for a reason. Perhaps that the youth detention facility is either at capacity, which is pretty rare anymore, or they may have gang issues where they have too many kids in one area and they don't want to open up another pod and staff something. So they need to spread kids out and they think it will be temporarily. Or there may be kids charged with very serious crimes and they're downtown at a county jail or in maybe a rural county jail. But let me tell you, there's a tremendous difference. Our youth system is so much better and equipped to deal with youth. They're specially trained. They provide great programming and services. They really recognize that more than likely these youth will be released at some point, and that we need to work on their skill sets and having them, be able to function in society in a really positive, productive way. Now, that is not necessarily true at the county jails. And I will tell you, most county jails will tell you, they don't want those kids there. They have to keep them sight and sound separate from adults.
Right.
It is extra work for them. They don't feel trained often to deal with them. So they get treated like younger versions of adults, which in some ways they are. In some ways they are not. I think the more we've learned about the development of adolescence is that particularly for boys, adolescence stretches all the way through ages, the middle 20s, if not beyond. The whole idea of the frontal lobe and executive functioning, this area where you make good decisions, quick decisions, is not fully developed. Now, that's not an excuse for making bad decisions all the time or being violent, but it is to say that some of these more minor activities are really things that if we catch young people early, move them in a positive direction, or if they're in the youth system as opposed to an adult system, it is so much better and the results are better for everyone, including the community.
Annette, you touched on all the things I wanted to ask you about underneath this heading of juvenile detention. So I'm going to flip over to Joe. We only have about 3 or 4 minutes left, Joe, but I want to talk about the Dutton case, and that was from back in '93. But it really just shone a national spotlight on what's missing with care for children who are in terrible situations. Can you talk about that case and what it showed us?
Absolutely. And that one struck close to home as that was a Rush Springs case, and I'm from Rush Springs. Those boys were significantly younger than me, but that happened while I was in college. And I remember back then, the news coverage, it made national news, and it did lead to changes in the system. And we're seeing those changes continue. DHS have been called out multiple times. And the kids lied to the caseworker because they were afraid for their lives of what their father would do to them. And it got to the point where they had to take the law into their own hands. So they held the gun and together killed their father because he had begun abusing their little sister. And their dad had told them, if anyone touches your little sister, you take care of it. And they were following through with that. I'm happy to report both those boys are now adults and doing great in their lives. Those are one of the issues where you can see where the kids were put with family and they ended up turning out okay. We have so many kids these days, though, that are facing issues. We have the case that's going on right now in the court system with the young man who was found in a barn, almost starved to death. If it had gone one day longer, he probably would have. We see too many of these cases that happen where, especially in a pandemic, where the abuse and neglect reports have diminished because we don't see those kids in a classroom. The teachers don't have access to them to see if there's something wrong. And so coming out of the pandemic, that's something we're definitely going to have to be prepared for. Going back to the earlier conversation, money was put into OU for mental health issues because we know that this is going to be an issue we're going to have to deal with.
As we come out of this, neither one of you can answer. As we wind up our time here, I want to talk about resources that are out there for folks Whether or not they access it is another story. And that's another problem that everyone has to tackle, getting people to access care, especially when they're living under fear.
So I would say, first and foremost, we have the child abuse hotline here in Oklahoma, and all of us, Oklahoma requires any adult that believes that a child is being abused or neglected is to call. It's a misdemeanor not to report that. But on the flip side, if you want to help support a family, let's say you just think they don't have the resources they need. There are numbers like 211, Be a Neighbor, and Parent Pro, and that are willing to step up and help folks get connected to the services that best meet their needs. Now, Susan, one of the drawbacks to this, though, is that if you live in rural Oklahoma, all these things that you may see listed on a website may not be available. They may or may not be available in Oklahoma City or Tulsa, but it is really challenging when you go outside the metropolitan areas. So I do think one of the good things to come out of the pandemic is that we have learned in a pinch, it's not perfect, that virtual visits and virtual support is absolutely better than nothing, and sometimes just as effective. So that is something that I believe we'll see expand. We're seeing mental health services provided that way, and I think we'll begin to see family support services that used to be home-based more and more be virtual.
Joe, I want to finish with you. I'll give you the final word. The Oklahoma Institute for Child Advocacy is having its Heroes Ball. You recognize folks who are working to make a difference in the state of Oklahoma, correct?
That is correct. And of course, we were very proud of our winners last year, including OETA for everything that they did for helping with educational opportunities during the pandemic to help get the resources out to families and to teachers to do that distance learning. One of the highlights of working at OICA is the Heroes Ball, where we recognize some of these tremendous advocates. And we're going to announce those winners in about a week, but you can expect that it will tie in with a lot of very relevant issues tied around the pandemic. And of course, it being the 100 years since the Tulsa Race Massacre and the education that's needed to make sure that we understand those issues in the past and we never repeat those. The Heroes Ball is going to be on July 30th. I do want to say that we are taking nominations for the People's Choice Award. We encourage individuals out there to submit their ideas for who would be the outstanding individual and organizational advocate of the year. And we would ask people to do that. And also, while they're at our website, we're cutting off on Monday. We're asking people to turn in requests for ideas for interim studies, the studies that lawmakers do over the summer. We want people to submit ideas for how we can improve laws for children with the topics we talked about today, or the entire spectrum of dealing with children.
All right. I want to thank both of you for joining us today. This is a topic that we really could go on and on about. There are so many resources to talk about. There are so many issues to explain and so much to be done. I want to thank both of your organizations for all you do. The Oklahoma Institute for Child Advocacy, OICA, and the Oklahoma Commission on Children and Youth. Thank you both.
Thank you.
Thank you very much.